Hello and welcome to the Tip of the Week. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mobile Veterinary Services, and San Francisco Stables. So this week I want to talk to you about how do you know if your pet is sick? There are obviously a lot of different things that may happen to your pet, anywhere from maybe eating something that didn't agree with it and it starts vomiting or having diarrhea, to becoming really sad or tired, something that we would call medically as being lethargic. It can have skin irritations, allergies, kidney disease, liver disease, heartworms. I mean, there's just so many things that can happen to your pet that, obviously I can't cover all in one little video. So the very best for your pet, if you remember that your pet ages a lot faster than you do, and so it's important to get a physical exam. We do recommend physical exams every 6 months, because as most of us know, pets age approximately 7 to 10 years for each one of our years. So that would be like us getting a physical exam about every 5 years, which isn't very often. So we do recommend just periodic physical exams. What do we look for during those exams? Well, we're looking at the ears, the eyes, the nose, the mouth, all the lymph nodes. Just like you, if you get sick and your lymph nodes swell, same thing with the pets. Lymph nodes are the drainage tract of the body, and so if you have swollen lymph nodes in your pet, that could mean that there's some kind of an infection or an illness, or it can be as serious as something like cancer. And so those things are important to check out. It's better not to wait. A lot of times what happens is people, think, oh, well, I'll wait a couple of days or wait and see if it gets better. And mostly it's just going to get worse. And then it's more expensive for you to treat because the disease is worse, and it's harder for us to cure and treat. Also, if you do have an illness, please be considerate to both your pet and to the veterinarian on call, and don't wait until 6 p.m., 8 p.m., midnight to call. If your pet is ill, call first thing in the morning, and that way you can get it in for an appointment and get it seen. It's really difficult to do a full workup on whatever's going on your pet if we're seeing it at 5:45 at night when we close at 6, or to be calling in the middle of the night when it's something that's been going on all day. That pet deserves the full attention that we can give it during regular business hours. Okay, so other things that you want to look for, so like I mentioned, look for lethargy, which is that being kind of tired and sleepy, not wanting to play, maybe not wanting to eat, or vomiting or diarrhea, just laying around, any skin irritations, any lumps or bumps that you might see. All of those things are important to notice. Usually what I recommend with my clients is get into a habit of pick a day that works best for you. For example, I do mine on the 1st of the month. Maybe you want to pick the 15th of the month, or whatever day is easy for you to remember. And do a little mini at-home exam. So you can pick that day, give your pet its heartworm prevention, give it its flea and tick prevention, clean its ears, brush its teeth, give it a bath if the flea and tick prevention is something that you give orally and not, topical. You can give it a bath, and then do a pat down. A lot of times during the baths you notice things on the skin that you may not notice when the hair is fluffy and dry. And so, check the teeth, check the lymph nodes, check the tummy, make sure everything is normal. Feel it for any lumps or bumps. And that's a really good once a month check on your pet to make sure everything is going okay. All right? So if you have any questions, any concerns at all about your pet, go ahead and come on in. Let's take a look at it. And we hope you have a great week. Take care. Bye-bye.